Hey guys, welcome to the podcast. So excited. This is a topic I have not ventured. Actually, I didn't even know what this was. So my buddy, Suzi Fraze, who was in our Aspire MSL program, who's just become a dear friend, approached me about this topic, and I was like, medical anthropology sounds great. Don't know what it is. So this episode is called Culture, Context, and Care, the Role of Medical Anthropology in Medical Affairs. And I have Suzi with me, and I have Sonika Garcia. Guys, I'm going to let you introduce yourselves. Sometimes I do the intros. I'm going to let you guys introduce yourselves. So, Sonika, why don't you go first?
Sure. Thanks, Tom. So excited to be here. So I'm Sonika Garcia. I work for Havas Health, specifically in the medical anthropology department. So my background is in public health and behavioral science. All that really means is I'm interested in what I do on a day-to-day basis is to understand why human beings do what they do. And I
Mm.
say human beings because I don't necessarily mean only doctors and patients, just stripping all that away, the human. I look at the way that culture, symbolism, all of that really affects the way that we think and make decisions. So yeah, I'm excited to get into this conversation.
Awesome, awesome. Suzi.
I'm also excited to be here, and I also work for Havas. I am in the medical affairs area, currently a medical writer, and I listened to a medical anthropology presentation here at Havas because I had never heard of medical anthropology either, and it excited me. It got my wheels spinning, and ultimately, I think that this is the future of medical affairs.
Awesome. I can't wait to share this with you. But before we do, I do have to remind you guys to sign up for Fierce Pharma Week, which is happening. It's coming up quick. So definitely register. It's coming up September 8th through the 11th, and that's at the Philadelphia Convention Center or the Pennsylvania Convention Center in Philly. And it previously Mass East. It's a much bigger event now because it also includes PR, communications, pharma marketing, business development, and licensing. And when you go register, put in the code MSL Talk, TALK, no spaces, and you'll get 25% off registration. So you just go to Fierce Pharma Week. It'll take you to the Fierce Pharma site, register, and I'll be there. It's going to be awesome. And I look forward to seeing you guys. So let's jump into this. First question is going to be an obvious one. And hopefully, I'm going to be like the number one person interested in hearing the answer because I don't really know what this is. But what is medical anthropology and how does it intersect with the goals of medical affairs?
Yeah, I can take that. So medical anthropology is a discipline within the larger discipline of behavioral science or social science, if if anyone's more familiar with that terminology. But it's really the study of how people make sense of health, illness, care across various cultures, various contexts. For medical affairs, I look at it as a secret weapon to medical affairs and doing medical affairs right. So it helps us really move beyond clinical data to understand how patients actually live, how doctors actually make decisions, emphasis on the word actually, and how science becomes action or how science doesn't become action.
Got it.
I would just add a little bit. Sanika absolutely said everything that I would have said. In addition, so medical affairs, we are all about understanding patient and provider perspectives, improving their health outcomes, and communicating science in a way that really resonates. So medical anthropology adds that depth by helping teams see beyond the clinical data into real world behaviors, cultural barriers, and health equity issues.
I get it. I love it. I'm learning. I'm learning things. I hope you guys are too. All right. So, Sanika, what's the difference between cultural competence and cultural fluency, and why does it matter in medical affairs?
Yeah, it's such a great point. I'm sure a lot of the listeners, it's such a great question. I'm sure a lot of the listeners have heard of cultural competency. Many businesses do cultural competency training, hospital systems. But there is a very important distinction, and I think it's some that, people haven't really thought of in that way. So cultural competency is really about knowing the basics of the culture that's impacting decision making.
Hmm.
Fluency is about speaking the language. And I don't mean the language, like the actual language that someone someone speaking, but the language of culture. So it's a difference between I'm checking a box and I'm truly connecting with someone. I think when we think about medical affairs, fluency lets us engage with that nuance. It helps us build trust faster, and it really avoids missteps that even the best data can't fix. We can have the best data, we can communicate that data, but if it's not with cultural fluency in mind, you're not going to change behavior.
Hmm. So then, why is understanding cultural context critical for translating science into meaningful behavioral outcomes?
Yeah, I mean, I think, right, like again, companies put billions of dollars behind these treatments, research, we have the data, but we get frustrated when data isn't actually changing behavior. It's not changing prescribing patterns. It's not getting a patient to take treatment. And that's because science doesn't live in a vacuum. I mean, nothing really lives in a vacuum, right? So it lives within the beliefs, the fears, the routines, the self-identity of people, without thinking about cultural context and like executing it through cultural fluency. We're honestly just broadcasting,
Hmm.
we're not making that meaningful connection. However, with cultural context, we're translating that really important science into action that actually sticks, and emphasis on actually sticks, because this is about long-term behavior change too. I'm sure you can get a doctor to write your medication for the next 5 patients, but if they're not doing it long term, it really doesn't matter.
Yep.
So yeah.
Yeah. I want to talk about like culture in practice. So, Suzi, I want to hear from you. So, how can understanding cultural beliefs and behaviors impact the way we approach scientific communication or education?
Well, understanding cultural beliefs and behaviors can be a total game changer in how we communicate science or educate our patients and providers. And this is because culture really shapes how people interpret their symptoms, how they trust the healthcare system, how they make decisions about their care. And if you ignore these beliefs, as Sonika said, you can have the best data. Even the most evidence-based messages can fall flat or be misunderstood. And so with KOLs, this anthropology reminds us that they're not just scientific authorities, but they're also cultural brokers. So we need to understand how they operate within the networks of influence. They carry reputational risk, and they have strong values that are tied to patient care. And if you understand those layers, it really helps you build trust and see it can show that you are a thoughtful and aligned partner, not just another MSL with a slide deck.
Yeah,
Awesome.
it's so true. I think what's really interesting, and I always go back to this, we need to not take the approach of here's what we want to say, but we need to think about here's what they need to hear. But, really putting the person on the other end of the communication at the center. And I don't mean that, like, of course, pharma companies, they try to, but it's always what's important about our treatment that we need to say.
Mm,
But shifting that a bit can really make a difference, just layering on to what Suzi just explained.
awesome. Sunika, let me ask you, I'm curious, can you share like a real world? I'd like to hear some real world examples
Mhm.
of where cultural context influenced a medical decision or maybe even a patient outcome.
Yeah, man. So, I mean, culture is it's such a broad word. It encompasses so much. And so before I get into the example, I want to say that when we talk about culture, we're not just talking about, rituals and language and things within a certain religious group or,
Mhm.
racial group. That is part of it, demographics, geography, but it's also the culture of medicine and how that differs. So when we think about doctors, like there's a difference between the culture of oncology versus the culture of dermatology. So I just want to expand everyone's thinking as they're listening to this and what we mean by culture. I mean, let's take insulin, for example. I'm working on a GLP-1 GLP-1 brand. We hear a lot about GLP-1. So in some communities, insulin is seen as, it's in medication, it's treatment, it's going to help you get your diabetes under control. But in other communities, insulin is not seen as a treatment, it's seen as a failure. And so uptake is delayed even when it's medically necessary. Why aren't you taking your insulin? And if I feel like I failed and that's what's being reiterated to me, and that's that's the mindset that exists in the culture that I live in, it's going to actually deter adherence. I don't even want to think about it. I don't want to approach it. It's going to be a barrier. In certain countries, Japan, for example, they do a great job at really integrating. So when we think about oncology treatment, right? I mean, it's very diverse. There's a lot to it. Certain clinics in Japan integrate respect-based rituals into cancer care. I was just reading about this. By doing that, adherence goes up. The way that people view their cancer care changes. So little things, bowing gestures are used by doctors, implementation of shared spaces, the understanding, and this is really across a lot of cultures, especially in Asia, understanding that family is very much an extension of the person when it comes to things like consent and decision making and how you approach, in the US, it's a bit different, right? With HIPAA and the way that you approach the patient versus their family, it's different in other areas of the world. Consent is very much not just the patient, but their entire village, their entire community. I mean, village from a community standpoint. So you think about little things like that. My last example, again, because I think this one is really important. When you think about food and cholesterol, we're working on an LDL brand, and it was so interesting because what food symbolizes in the US, we look at food as a risk factor. So, manage what you eat because your cholesterol could go up, things like that. In other countries, for cholesterol awareness, they stay away from framing food as a risk factor. Instead, they honor that food symbolizes things like togetherness and harmony and everything that's good in the world. And so, you don't want to frame up messages in the way to make food the enemy. Little things like that. I know I'm getting a bit into communication too, but it's so much. There's so many ways that culture needs to be considered when we're messaging and we're talking about different disease states.
Yeah.
So I'll stop talking now.
No, that's helpful because it gives us, real examples. Like I kind of, started to kind of understand what this is, but now that you put that into real world examples, it's a little easier to kind of conceptualize. But now that makes me think, what's the risk of not considering culture and context in
Yeah.
medical affairs work, especially as we look, globally?
Yeah, I mean, man, the risk is so significant. You risk being irrelevant, you risk resistance. I think worst of all, you risk being clinically right, but behaviorally invisible. If someone is not resonating with your message or culturally it's completely fallen off, it's not the way that people interpret certain symbols or behaviors, you're losing the person before they're even able to finish reading your entire message. And in a global setting, that means wasted resources, mistrust, misimpact. You really can't, even the best data can't fix a message that's not resonating. So, I mean, I think you risk a lot.
Absolutely. And I think this isn't just about being respectful. This is about being effective in your communication. And these cultural missteps can actually tank engagement. It can delay uptake. As we've already said, the best data is going to land on deaf ears if you're not approaching it from a place of true human understanding. And ultimately, it damages long-term partnerships. And that's what MedAffairs is about. It's about creating these real partnerships with HCPs, with these KOLs, with a goal of ultimately improving patient lives. But in order to improve patient lives, we need to engage on a level in which they understand, that they feel respected, that their cultural nuances are and their assumptions are either validated or challenged, but they need to actually be able to be in a place where they can accept the information that you're giving them.
Awesome. And that makes me think, as you say that, it makes me think about the KOL community and KOL engagement. So I'm curious, how can medical anthropology insights improve stakeholder engagement, particularly with, not just HCPs, but also patients?
Yeah. Well, and I know a lot of my answers, I mean, have been more patient focused, but it's very important for both audiences. So I think what medical anthropology really brings is it helps MSLs move beyond the clinical script into the world of real human context. It's not, think about a doctor. It's not just what a doctor believes about treatment, but it's why they believe it. How is the culture of their patient population, clinical restraints, right? I mean, yes, it's the culture of patients, but it's also the culture of the world that the doctor is living in. They live in their own little world, in their practice setting. Regional norms that influence that belief. So I'm going to talk about patients and doctors together. What anthropology asks is what's really happening beneath the surface, really from a cognitive mindset standpoint. That's where the real engagement lives. So we need to not work on educating our stakeholders. We forget that it's our job first to understand their lived realities. So stigmas, cultural values for patients, for HCPs. I mean, again, I mentioned like context within their practice, but workflow friction and institutional culture is huge. And I brought up how, there's a culture of dermatology, there's a culture of oncology. These doctors, say you have a doctor who's in their 50s, they've been practicing for 30 years. These are entrenched ways of thinking.
Right.
They're anchored to from medical school. So a message about why a treatment has the best efficacy is simply not going to do the job alone.
Agreed. And while in medical affairs, most of our engagement is with HCPs, ultimately within pharma and med affairs, there's a bigger and bigger drive to really be more patient-centric and also promoting patients as partners in shared decision making. So in order to do that, we need to equip our physicians, our HCPs, with the right patient education that appropriately is tailored to their patient demographic. And equipping these HCPs with tools that will help them understand context for these patients that they're speaking to. It really helps them have better communication, better conversations. It really helps the HCP understand their patient on a better level. So in order for us to help HCPs facilitate those communications, the med affairs teams need to really understand the barriers that our HCPs have.
Yeah. And to that point, and Suzi, like, curious what you think about this. I mean, I think that we focus and do like HCP segmentation and we're trying to understand our HCPs better. I feel like we tend to rely on the same subset of HCPs. So like the urban, academic, well-resourced, knowing that that's not the patient population that they're seeing. And so I think that really bringing in the voice of the community and community-based physicians, more rural providers, HCPs and federally qualified health clinics, things like that, really thinking beyond, okay, sure, we might be speaking to an HCP in an academic setting. However, thinking more zoomed out and largely on who they're serving, we need to maybe talk to other HCPs as well, that we don't always take that approach.
Right. Agreed.
It's so interesting having this conversation with you guys because there's a lot of focus and perspective from the patient side. I mean, we have a patient advocate and a nurse who are both obviously very, very smart and know so much about healthcare and medical affairs. So this is a really interesting new perspective for me and obviously for my audience. So I'm loving it. So Suzi, how can medical affairs teams better incorporate patient perspectives, especially from like diverse populations?
So to
I,
really,
yeah,
sorry.
no, go ahead.
To really embed diverse patient perspectives into strategy, our medical affairs teams need to go beyond the advisory boards and the surveys. They really need to listen differently. And that's where the anthropology style thinking really comes in. So we tap into qualitative insights, ethnographic research, patient narratives, community health workers, and even social listening. And these sources really reveal the lived experience and the culture and the systemic barriers that exist within our healthcare system. And then partner with cross-functional teams to really translate these insights into real action and real change. And that, creates adapting educational content. It can transform clinical trial design, and it can really shape field engagement.
Yeah, I mean, you said cross-functional teams, and part of that cross-functional team needs to be the person who's on the end of receiving the message. So patients co-create with the patients. Don't just, yes, research is important. Do the ethnography, do the interviews, but don't rely on like, an academic expert or even myself, a behavioral scientist, to then take that research and analyze it and make decisions. I should be making decisions with the community, and yeah, co-creating with them. That's really, really key.
Because ultimately, we interpret things through our own lens. We need to learn how to interpret things through patient lens, through HCP lens, because we all come with our assumptions. And that absolutely impacts how we process day-to-day interactions. So to really become aware of your assumptions and also the assumptions of our healthcare providers and ultimately downstream the assumptions of our patients really helps create tailored messaging. And the tailored messaging is what is going to move the needle for our patients.
Yeah.
So then I'm sure there's gaps. So where do you guys see gaps in pharma and biotech companies that are trying to address cultural competencies and contextual understanding?
I mean, I could take a stab first. I mean, I think ultimately we just conflate awareness with action. So pharma checks the boxes with bias training or, some sort of cultural competency training. But we rarely build the cultural insight into the core of the strategy. And it goes back to my co-creating point. So we need to move beyond the thought of, we know this population exists and we need to research them, to we have designed this and this strategy supports the realities that they face, whether it's how they define health and wellness, whom they trust, what influences their decisions. I mean, I think, okay, listen, we're headed in the right direction, but I think it's going to involve a bit more of like, we know our target, we're going to understand them by the books, and then we're going to take that knowledge and create for them. We need to really embed ourselves a bit more and thinking about even what are the symbols in which that exists in their community. What language are they using to explain, certain health concepts? And so I think it's a bit more. And again, like cultural competency training is happening, cultural fluency training, cultural humility training. Those things are not happening, and I think that's a big gap.
Agreed. So there is a heavy reliance on the surface level diversity metrics, but that doesn't really dig into the deeper contextual understanding of what it is to just be human on an individual level. And the strategies get built on assumptions and not true insights. And as Sonika said, there's lots of trainings but it feels like more of a check the box kind of training where, you maybe can have a conversation that is more respectful, but are you really understanding the key drivers of that relationship and things that will really resonate with the person you're speaking with? And this does translate outside of med affairs and pharma. It really is the human to human component of interaction, and how can we really make the partnerships more effective? And you are looking at the disconnect between insights and how they're actually used.
And what about like tools? Are there tools or frameworks that medical affairs teams can use to integrate some of these philosophies into their clinical strategies, medical education, insights?
Yeah, I mean, I think it's it's a lot. It's where we're talking about it, but we're not expecting anyone to know, like in medical affairs or on the pharma side, to understand, how to actually make any of this happen. But consulting with and having programs, training programs. I actually just created a training program for a company for their MSLs, to like a behavioral science training, right? Exactly what we're talking about. What tools can we give them? What frameworks can we give them? Medical affairs, MS, they're busy. We're not expecting you to read a behavioral science book and like apply it, but what are some quick, easy frameworks that we can give them to understand their doctors better? And so I think it's a multi-step. It's one, helping MSLs in a very digestible way, and medical affair teams in a very digestible way understand how do I even gather this insight? Like, what do I do? Where do I start? I love thinking about populations from like a rational, situational, emotional context. I mean, it's just three easy like buckets. And if you can even just do that, I think you've made a lot of progress. Helping them insight generate through through like a framework like I just mentioned. And then once you have all this insight, okay, well, what do I do with it? I think there are really great behavior change frameworks out there. There are a lot. I love, specifically in the context of talking in medical affairs, I love like the BJ Fogg model, the COM-B model. They're easier to grasp and really effective when it comes to doctors. So things like, does the doctor or the patient have the capability, the opportunity, and the motivation to even do what I'm asking them to do? Because if one of those things doesn't exist, you're not going to do it. And so using all that insight and generating it through a behavior change model, and I know it still might seem like a lot, but truly, like, it is simplified enough where anyone can do this, and it makes so much of a difference. I'm talking to a doctor. I now can understand that it's really the fact that they don't have time. They have too much on their desk, and they're in an inertia cycle where they're just like, you know what, I don't have time. I have 5 minutes with each patient. You're telling me to do something different? No, I'm just trying to survive. If I'm having a conversation with the doctor and I can pick that up from them, then I understand that is a institutional context that is serving as a barrier. If I'm hearing from my doctor that they're referencing maybe a past experience that didn't go so well when they tried to do things differently, now I know that emotion's at play, and that's a harder barrier to sort of overcome. So even allowing MSLs or helping MSLs pick up things like this in conversations with doctors is, you're already you're already moving the needle so much.
And let's
Yeah.
talk about MSLs, because that's the majority of our audience. So I want to get to like the MSL piece of it. So Suzi, how can medical science liaisons play a role in identifying some of the cultural nuances when they're interacting with their HCPs and KOLs?
Yeah, so I see MSLs as being in a really prime position to understand these cultural nuances because their interactions, they're on the front lines with these HCPs in the HCP's local environment. So they can pick up on those subtle cues. And I think there's the assumption that, well, they're in clinical inertia, what they're doing is just easier to keep doing. But to really understand what is perpetuating that clinical inertia rather than just saying, well, they don't want to change because X. Well, that's based on the MSL's assumption. So dig into what are the perceived barriers of each individual HCP. And again, it comes down to tailored messaging. Understand what is this HCP's perceived barrier. And then instead of coming at them with talking about ABC, what's more tailored to their individual need is XYZ. And now you know that. So you understand what matters to them, you understand what barriers they are facing on an individual level, and what might be challenging them to really change their clinical behavior. It helps you ask the right questions. It helps you give them better answers. And it really uncovers their priorities. And sometimes these priorities are maybe even assumptions that the HCP themselves don't even know that they have until you ask them the question. Say, okay, you seem like you really want to do, you want to keep doing this. Can you tell me why? And can you tell me why, what you would need to hear to maybe have some changed behavior? So it really helps you enable the conversation where you can really extract the information that you need to hear to help this HCP really understand assumptions.
Mm. And then that makes me think of like how should companies go about training their medical affairs professionals and MSL teams on all of this that we're talking about?
Well, the great thing is, for the MSL role in particular, having emotional intelligence is really a key factor. So I feel like a lot of hiring managers are already trying to find people who are emotionally intelligent because you can't just have the science, you have to have the people skills. And medical anthropology gets down to the root, the base level of human on human reaction or interaction. So you already have folks who are set up for this, but to really help them challenge their unconscious biases, help them really dig down into the root behavior, the things that will ultimately drive communication and drive behavior change.
Yeah,
Awesome.
totally agree.
Cool. All right. So let's see, what time do we have? All right, we still have some time. This is like one of those conversations. I think we may have needed like a full hour to talk about this because there's so much to
I
kind of
know.
uncover. But
Tom, I have to tell you, I'm really like exercising self-control because I'm like, okay, do not go on and on, but because there's so much to talk about. And I'm like, all right, let's keep it short. But yeah, I mean, there's so much to unpack. And just to layer on to what Susie just said, I think when it comes to training, making sure that you're delivering information in a very bite-sized, digestible way. If you need to do trainings in different parts, do it because like, again, MSLs are humans, they're only able to digest, a certain number of information. It's a lot. They're not used to this kind of information necessarily. So I would say in addition to everything Susie mentioned, make sure that it's digestible in, separate trainings.
got you.
And to kind of shift away from, okay, I need to get through this deck. I need to talk to this new KOL and I need to get through this deck. Maybe your first metric, the first thing that you do with engagement, what success can look like is understanding that HCP on their individual level, looking at them through their own lens. So understanding those assumptions, understanding where they are coming from, that might be the best first step. And it's not even getting through your deck. It's, understanding this person on a human level.
Yep. And as we're talking about MSLs, there's always the topic of insights and how important insights are. So for MSLs and field medical teams, how should they take cultural insights and communicate them back to the organization to help influence strategy, um, and the future kind of direction of the organization?
I mean, I think it's really about looking at this as less of an add-on and more of like an actual integrated strategic operating lens. So, okay, so an MSL is gathering insight and then they have to share it back to their organization. I mean, I think keeping that conversation, that communication regular, and not, once a year we're having these conversations. It needs to feel more embedded into the day-to-day. So that way, not only that it becomes more like second nature, but that everyone in the organization is sort of speaking the same language and understanding it to the same capacity. Because I would, in the future, and we're heading in that direction, I would love to see behavioral science and medical anthropology really like stepping more into this integrated role where everyone has this sort of department in their organization because they see that importance, right? It's not just about understanding culture and delivering that insight back. It's about designing through it. And so for medical affairs, I think that means a shift from, as I mentioned before, like a scientific storyteller to really translating the context in which someone is existing. And when you are delivering that information back to your organization, if the organization is thinking this way too, then it's received more effectively. People are able to know what to do with that information. A lot of times our biggest barrier is that we talk about these things, we deliver this information, and then people are like, well, I don't really know what to do with it, and I'm confused, and it's not talked about enough, and so I'm just going to do nothing. And it's totally understandable. Like that makes sense, right? It's sort of like just a bit of paralysis on, I don't know where to go from here. I'm not an expert. So I think just embedding it in a way that makes it more digestible and understandable for everyone in every role, because I don't think there's any role in a pharma organization and medical affairs organization that cannot benefit from this way of thinking. So yeah, I think it's just investing in new types of insight gathering, the way that we're communicating that insight gathering back to our organizations. And yeah, again, just having this be more embedded into overall strategy.
Got you.
Absolutely. And I actually see medical anthropology as the missing piece in medical affairs right now. We strive for these relationships, that's ultimately what we want. We want these relationships. And I truly think that teams that embrace medical anthropology will surpass, I think they will create new metrics because right now metrics are kind of a touchy subject in med affairs. Med affairs is constantly trying to prove their value. And, we know our value, but, it's not based on sales. It's based on, different, more subjective metrics. And for teams that are really creating this deeper connection with KOLs are going to see the needle move. And those are going to reshape metrics. It's going to reshape how we interact with individual HCPs. And ultimately, in an era that's defined by generative AI, the existing questions about future work, medical anthropology can really reorient us. And it brings us back to what is deeply and profoundly human. And it brings that personal level back. And it's where meaningful change begins and where better patient outcomes can actually take root. And I do believe that the teams that do not engage in medical anthropology will be left behind compared to teams that do embrace medical anthropology.
Boom. There it is, right there, folks. Awesome. Well, thank you guys. That was awesome. And medical anthropology, who knew? Now I know. I mean, it's amazing. And real quick shout out. So guys, if you see me drinking out of this mug, and if you can't see it, if you're not looking at YouTube, I have this mug and it says my name on one side and it says published author on the other. And Suzi gave me this after I launched my book. So thank you, Suzi. I use it every day. I'm using it right now.
I
So
love that. It's a great book too.
yeah, quick shout out. If anybody's looking for a job and you haven't bought my book, first of all, shame on you. Second of all, Job Search Mastery, How to Win Your Dream Job. Get it on Amazon. Guys, Sonika, Suzi, you guys are amazing. This was such an awesome conversation and I learned a lot and I hope everybody else did too. And if you did, share it with others. And as always, appreciate your support of the show. Love you guys and we'll see you next time.
Bye. Thank you.
Thank you.